Hello, future nurses. Welcome back to our series on health assessments. Today, we're going to dive into the head and neck assessment. Now, understand that, it's crucial as nurses to master this and all of the assessments because they help gather information about our patient's health. Okay, so let's get started. Now, our head and neck assessment involves, asking the patient multiple things. Have they had any headaches, any dizziness, lightheadedness? Has there been a history of a head injury, loss of consciousness, seizures, neck pain, any decreased range of motion in the neck? Numbness and tingling, lumps or swelling, difficulty swallowing, any medications they've been taking recently, um, surgical history, and of course, neck pain. Um, all of this kind of helps, gather information like, I keep reiterating about the client's history, um, and what brings them in for the visit. Now, when we're looking at assessing the head and neck, our focus is on inspection and palpation. We want to ensure that the size and the shape and the symmetry of the skull, so we're going to go through the steps. Now, when we're looking at the skull, ensuring the size and the shape, we're also going to be assessing for any masses, any tenderness, any abnormalities. Remember to not forget to check the frontal and maxillary sinuses for tenderness. Remember that, you're going to assess that um, temporal mandibular joint, testing for any crepitation, limited range of motion. And you're going to do this uh, with testing, testing cranial nerve 5, the trigeminal nerve. You'll be testing that by asking the client to open their mouth and from moving it side to side. When we're looking at the face, it's always checking for shape and symmetry. You're looking for any involuntary movements, any swelling, like periorbital edema, which is that swelling around the eye. That's definitely one thing that you want to look out for during your assessment. When you're moving down to the neck, you want to assess for symmetry of the accessory muscles. You're going to test cranial nerve 11, the spinal accessory nerve. And this involves, asking the patient to push against resistance um, to assess muscle strength. So you'll ask, you'll put resistance against the chin and have them um, turn their head into your hand to test for muscle strength in the neck. You also, as you go down, you want to look at that trachea. You want to make sure that it's midline and without any kind of deviations. You want to check the thyroid gland. Ask the patient, sip some water and swallow. And you're assessing if that thyroid tissue moves up and down. Okay. And then you're going to start moving down. You're going to start palpating the lymph nodes. Now, palpation is key. You're going to take some gentle pressure and in a circular motion with your fingertips, start at the pre-auricular nodes and then moving down to the supraclavicular nodes. So there's a lot of them. Um, when you're assessing them on both sides, because you're doing them at the same time, because you're comparing them, You want to look for any size, shape, location, mobility, tenderness to the lymph nodes. And so you're doing this with a circular motion down the neck and then to the supraclavicular space, looking at those nodes. And like I say, comparing both sides uh, for symmetry. And when you're teaching your clients, you want to really stress to them the importance to go to the healthcare provider. Persistent headaches, if they have any headaches or dizziness or neck pain. You want to tell them, if you have any swelling or lumps in your head or your neck region, you need to go immediately. Tell your provider immediately. And remember, when a neck injury is suspected, no neck movements are performed. Okay. Uh, and so that kind of concludes it. uh, you know, Mastering that head and neck assessment, is important. And it'll come with time, it'll come with practice. But this is a brief overview about that assessment. So I thank you for watching Nurse Ed Scholar. Stay tuned for more health assessment, overview of the health assessment. I guess this is a health assessment series. So until next time, happy learning.